Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to DESI TV USA. I am Tabinda Gul. Let's take a look at a very special report. Today we are joined by Dr. Tariq Bhatt from AXS Community Health Network, Mohammad Awadraogo, CEO of Illinois' largest federally qualified health center, and board member Perla Herrera. They will discuss efforts at the Capitol to address healthcare funding for the uninsured and underinsured. So let's hear what they have to say.
Good afternoon. I am Dr. Tariq Bhatt from AXS Community Health Network, Vice President of Health Affairs. With me to my right is CEO of largest federally qualified healthcare center of Illinois, AXS Community Health Network, Mohammad Awadraogo, and to my left is Perla Herrera. She's the board member, consumer board member. So I'll ask them what they are doing here today at the Capitol, because it's a very important piece of the puzzle or equation to figure out how to fund for uninsured or folks who do not have enough or adequate resources to pay for their insurance. So welcome to Capitol TV. And can you say a few words about what brings you here?
Absolutely. Thank you, Dr. Bhatt. Like Dr. Bhatt said, I'm the CEO of AXS Community Health Network in Illinois. So it's one of the largest FQHC actually in the nation. And then we are the largest in Illinois. So we are here because community health centers play a big role in healthcare in America. We serve, 32.5 million patients that we've served last year alone. So that's a big number, and 1 in every 10 people that live in the United States get their healthcare in a community health center. So we are here with Congress because we want to advocate for Medicaid. We want to advocate for our workforce. There are a lot of legislation that are impacting how we retain and attract talent for our workforce, because it's hard to retain those people in medically underserved area, for example. We're also here to ask Congress to act really to protect 340B. 340B has become a critical piece of what we do for the patients. It's literally a life and death situation in most cases. A patient deciding between paying for their prescription or putting food at the table or paying for rent. So that's kind of what we're here to advocate for. There's also 2 programs that are very important in terms of workforce, because it's hard for every FQHC to really attract and retain talent. That's the National Health Service Corp and then the Teaching Health Center programs. Those fundings will be ending in March, so we're here also to advocate to extend those funding. And then last but not least, telehealth is another reason why we're here. Congress, with the pandemic, had a lot of flexibility around telehealth, but it turns out that that's really so great for our patients, because one of the things that we deal with is social determinant of health. And patient not having transformation, either geographically not close to our health center, we're creating a lot of barriers for those patients to come to service. And through telehealth, we are able to reach to those patients and then continue having them to have access to care. But we want flexibility in the programs. We want parity in terms of, if we're providing services, we want to get paid the same way as if it's in person, because that's the same services that our providers are giving to our patients. So again, that's why we're here, and urging Congress to really vote to protect 340B, to protect some of those legislation that I've mentioned, because overall, when you invest in community health centers, you are actually saving money. There's a CBO report that said if you have $5.8 billion funding in all community health centers, you will generate $11.4 billion of savings in Medicaid and Medicare programs. So again, that's why we're here to advocate. But I'm going to pass this to Perla. Perla is one of our consumer board members. That's what makes FQHCs unique, because we have board members that live and work in those communities that we serve. And Perla can tell you a little bit about 340B and how 340B helped really save her life and continue to be a great resource for her. Perla?
Thank you very much. And hello, everyone. I'm here advocating and giving my voice, and really here just asking to please keep us alive. Basically, 340B keeps me alive. It keeps me from bleeding from my stomach. It helps me from stop having heart attack. The medicine that I'm receiving, I cannot afford on it my own. I rely on 340B to be alive every day, to be able to wake up, to be able to tell my family, I'll be there to support you. I'm going to be there with my grandchildren to meet them. 340B has awarded me this. Community health centers, what did they do? They saved my life. You see, I didn't have insurance, but I had breast cancer. I chose, and I thought, well, I'm going to have to make that decision. I'm going to work until I can save enough money to be able to bury myself, so I don't have to leave the burden to my family. FQHC, AXS Community Health Network, said, no, lady, you're going to live. We're going to show you how, and they did. They gave me hope. The first time I felt that I was listened to, that I mattered to anybody. This is not only my story. This is every neighbor's story, every person across the street. 20% of my family goes to AXS, goes to an FQHC. If it wasn't for them, 20% of us would not be here. You see, the struggle is real. The worry is real. My medication, I will not afford. If it wasn't for 340B, again, I would not be able to get those prescriptions that are life savings to me. Now, I'd be at the hospital every little while in the emergency room, costing the state so much more. When all it takes a few pills to keep me going, to keep me safe, to keep me healthy. That's why I'm here. I'm asking, please, think about us. We are the ants of this country. It is a domino effect. If I go, it trickles down to my children. It trickles down to my grandchildren. It's not just me affected. It's 3 generations. Please, let's think about that. It is so important. FQHCs. Here's another one, Health Corps. I go to the clinics, and the girl taking my vitals, or the young man taking my labs, they know us very well in the communities. I want someone who looks like us, that understands us, that I can say this is what's going on, and they're going to understand me. They're going to understand my food insecurities. They're going to understand that I might not be able to pay my rent the next month, and they're going to understand how to help me. This is my ask.
Thank you, Perla. Thank you, Mohammad Awadraogo, CEO, because that's what federally qualified healthcare centers do. They provide care to everybody who walks into their door, whether they have insurance or no insurance. They'll sit with the same folks, and they'll be treated with the same dignity. So please preserve this program. Thank you so much again.
Now, thanks to our guests for their valuable insight. Addressing healthcare for all remains a crucial issue. So this is me, Tabinda, signing off. Stay tuned for more news. DESI TV USA, DTVNN, and our OTT platform, DTV Flex, where you get access to over 3,000 channels. So stay tuned and stay with us.